Again, everyone. My name is Marty Guthmiller. I am the CEO at Orange City Area Health System, bringing you today the 61st edition of our COVID-19 community briefing. Today is October 5, and it is a Monday. Since Monday, we do have a local scoreboard that we're able to present. And in general today, I'm going to talk a little bit more about specifically what's going on here. On the ground, so to speak, and probably a little bit more than I normally would. So today, we have 535 positives here in our health system of the 3,962 tests conducted. That is a 13.5% positivity rate. Last time when we spoke that rate a week ago, that rate was 12.67, so that has climbed a little bit. Just in the last week, as an example, we had 104 positives of the 559 tests. So we did 559 tests this last week, 104 positives. That's an 18.6% positivity rate for the week. This morning, as of about 10 o'clock, we had 15 inpatients. 8 of those inpatients were COVID-19 patients. Our ER is functioning well. Our staff is holding up amazingly well. You can be so proud of the care that is being provided by our nurses, our physicians, our techs, our therapists. They're doing well. COVID patients are being kept in negative pressure rooms, which is a luxury actually that we have, that all airflow when you open the door moves outside as opposed to back inside into a hallway. So we do have negative pressure rooms and our COVID patients are in those rooms, and that is an extra step that we are pleased to be able to offer to all of our patients. We're doing advanced therapeutics now. Convalescent plasma as an example, remdesivir as another example. We're doing oxygen treatments. And we still have the ability for critical transfer. So if somebody goes beyond our ability to care for them here, we do have the ability to transfer. I want to be really clear about that. So if high flow oxygen or a ventilator might be needed, those transfers are still available, and we do have room to do that. I will talk a little bit about employment, because one of the pleas that we've had is to mask up and practice good hygiene, those kinds of things, in part to keep staff safe out in the community. Staffs are moms and dads and grandpas and grandmas and things like that. And we currently have 21 staff either positive or quarantined at the moment. As a little bit of a historical perspective here, May through August, for that 4-month period of time, we had 14 total positives during that 4-month stretch. Since September 1, so in the last 5 weeks approximately, we've had 38. So when we had 14 in 4 months and now 38 in basically 1 month, it gives you an idea the siege that we're under. And we're able to do okay in terms of drawing from our bench, but as we mentioned, our benches are not deep. And so we don't have a great deal of people to continue to draw from. And we want to try to keep everybody as healthy as possible. Also regarding today and the local happenings, we did close Landsmere Ridge this afternoon to visitors. After learning of a couple staff and tenant positives. We want to nip this thing in the bud right away. We want to get this thing locked down. And so we have initiated a no visitor policy at Landsmere Ridge, effective immediately, and probably for the indefinite future, but probably the next 10 days to 2 weeks would be a pretty good guess at this point. Check with Kelly at Landsmere, give a call out there. Window visits are allowed. Residents, tenants are able to move about in the building. They'll be socially distanced at meals and are being asked to wear masks while in the hallways. So thought you needed to know the latest at Landsmere. Prairie Ridge, current status there is we are testing staff twice a week. So every staff member 2 times weekly and all residents weekly. So there's a lot of testing going on out at Prairie Ridge. We're doing everything possible to keep that virus away. And if it does show up, we're going to do everything we can to isolate it as quickly as possible and keep everybody as safe as possible. Again, as you know by now, those are our most vulnerable people, and we want to try to do everything we can. Window visits are still okay at Prairie Ridge, as are the outdoor visits, weather pending. With the barriers that we have established to provide appropriate social distance. So those are a couple things going on the ground here. There's no question that we're in outbreak status. Our folks are holding up well, and very grateful for the resources that we do have available in this community. Going back to our statistics, Sioux County, 1,891 positives of 8,315 tested. That is a 22.7% rate. Rate continues to go up. That's 95 additional positives since Friday. The 22.7% in previous reports were 22.3 and 21.6. So you can continue to see the laddering up of that percentage. The number that looks at the 14-day moving average of positivity is changing a little bit too, not dramatically enough. Sioux County is still number 2 at 27%. So the time before we were at 27.7, before that 29.6, and the time before that 31.2. So we are creeping in the right direction. And so at least it's going in that direction as opposed to the other, but we remain number 2 in the state at 27%. Lyon County, number 1, 28.8%. They too dropped 2 percentage points from 30.8, but still a very high number. O'Brien County at number 5, 19.2. They actually went up a little bit, 18.6. Plymouth County is number 10, and they are at 16.2%. They were at 15.7. There are 37 counties in the state currently at a rate of a positivity rate over the 14-day average of 10% or more, so 37. Those numbers previously that I've reported were 34, 31, and 35. So across the state, the 10% and up numbers continue to climb as well. Region 3, 89 hospitalizations, a bit of good news there. That number last time we spoke was 97, so we dropped 8. ICUs though are the same, 18, and that is the same that we reported last time. 13 have been admitted in the last 24 hours, which is still a pretty high number as well. Again, most importantly, availability with vents and beds in the area is not in question. There's more than ample supply at this time in Region 3 in the 20 counties in Northwest Iowa. The state of Iowa, creeping up on that 100,000 mark, we're at 92,986 of 824,529 tested. That's a positivity rate of 11.3%, again, climbing steadily. 11.2 previously, 11.1 before that, 11.0 before that. So from 4 times ago, 11.0, 11.1, 11.2, and today 11.3. Hospitalizations in the state of Iowa, again, not a good number. It climbed again, 364 hospitalizations in the state, 361 previously, 315 prior to that, and 276 prior to that. Sioux County is at 14. Previously, it was reported we were at 23. As I mentioned, we have 8 alone today in Orange City. My colleagues in the county are projecting and indicating higher numbers as well. So my guess is that when we talk again later in the week, that number will be up there again. But again, the official report here is 14 in Sioux County. O'Brien, 7, that was previously 6. Lyon County, 1, previously 0. Plymouth, 8, previously 9. Woodbury County, the new number 1 in the state, at 35. They were previously 34. Polk County, which has held number 1 forever, it seems, is at 30, and that's down from 34. So Woodbury County leading the state in hospitalizations at 35. We had some additional deaths again as well, 1,388. Sioux County is officially at 4. And in a quick look on the demographics, there is no change. The virus has been very consistent in terms of who it most negatively affects. And again, 89% of those deaths are in the age category of 61 and older. I'm going to sound like a broken record, but again, we implore you, particularly in this area here in the Sioux County, Orange City area, mask up, avoid groups, and when you're in group settings, socially distance yourselves. Mask when there's any question at all, please mask. Proper hygiene is important too. Hand washing, hand disinfectant. Continue to do these things. Folks, if we hang in there and do these things for a couple of weeks, we're going to see some great improvement. So thank you to all of you who have been doing that. We appreciate that. We appreciate the ability to have our workers here that are able to work and function and take care of those folks who are in need. And again, I'm incredibly impressed and humbled each day when I see the resolve in the eyes of the folks here in the health system caring for people. It's good stuff, and I wish you could all experience that. I also want to mention that our Test Iowa site continues every Monday through Friday morning from 7 to 9 a.m. You can walk in to our occupational health clinic on the west end of our campus. Go to the testiowa.com site and register. You will get a QR code that'll be downloaded to your handheld device, your phone. Bring that QR code in, and the test will be provided free to you. Thank you again for all the support that you give Orange City Area Health System, all of our workers, all of our staff. Again, we ask for your support and help in battling this virus. Again, use common sense out there, stay strong, stay vigilant, and above all else, stay healthy. Thank you again for joining us.